The overwhelming majority of babies born at St. Joseph London do just fine, and we're a popular spot for care. Deliveries have doubled over the last 15 years. But of the 1,200 or so babies born at our Level 1 nursery each year, about 100 require additional care at a Level 2 nursery in Lexington. That means just minutes after birth, the baby has to be taken from the family, loaded into an ambulance, and rushed an hour and a half away.
It is a big impact for the patient because you're being separated from your child. You're calling to know what's going on. Most families, you want to be able to see, you want to be able to know your baby's close, you know what's going on minute by minute, so it does impact the family a great deal.
St. Joseph London is so crucial to the medical needs of Eastern Kentucky that many women drive 2 hours each way just to see an OB/GYN here. Now add on having to stay in Lexington for weeks at a time with the preemie in the hospital there, or driving back and forth many nights a week, and the burden becomes all-encompassing. And the research is clear. Premature babies who have skin-to-skin contact with their mothers show benefits that are still measurable up to a decade after their birth.
It's very important that we get the mom and baby together and be able to help these moms be able to take care of these babies when they go home. And by them being apart, that really is a huge barrier.
So that's why we need your help. St. Joseph Hospital, this community, and this part of the Commonwealth needs a Level 2 Neonatal Intensive Care Unit, or NICU. 24 hours a day, 7 days a week, doctors and nurses will be available to care for some of our tiniest patients. Some of these infants reflect a sad reality of our world today. Dr. Barton says about 12% of infants born at the hospital, 12%, show signs of opiate exposure. They need specialized care, which in many instances can't be delivered in our current setting. This new facility will also benefit well babies. By having this new advanced unit, the skills our medical staff will develop as a result will help, meaning a higher quality of care for all of our tiniest patients.
We're able to get teaching supplies to be able to use to teach our nurses how to give better care so that it's give back to the community, because in the end, the patient benefits from it because you've got more experienced nurses that know how to deal with different situations.
The stress of having a sick baby is difficult enough. Layer on top of this having the baby possibly hours away from their mother, and it's just a poor way to deliver care. By having a new Level 2 NICU here at St. Joseph London, these tiny infants and their families can get the care they deserve right here at home.
I've had women come back to me and tell me they've slept in their car in the parking garage at UK. And you're like, gosh, it just seems like we should be able to do better than that.